About how thought field therapy helps a number of psychological problems more quickly and more comprehensively. I've been interested in physical problems that people have, one in reducing them and two facilitating an adjustment to them. So the first area that I published on was vertigo, that if people came in a state of vertigo or dizziness, I would then treat them in it. And while they're in that state, that the dizziness would go away, and then I would follow up to see if they had additional states of dizziness. The most interesting of those cases was a man who could not sleep in a horizontal position. He started sleeping in a recliner. He would not only get dizzy, he would get a panic attack. I prepared him. He lay down on the floor. The symptoms occurred. I treated him with thought field therapy, and they went away, and he was able to start sleeping in a bed. I also am interested in tinnitus or tinnitus. You'll hear it's basically ringing or buzzing in the head. All the literature basically says you can't reduce it. There's not a treatment out there. Maybe if there's a specific pathology, maybe there's a form of treatment. So what I focused on is adjusting to it. So I would have people think about, okay, think about you have the noise in your head. How does it make you feel? It makes me feel pissed or frustrated. And then I get a SUDS rating, and then you treat that, and you get to 0, and you see if there's any other parts to it. With tinnitus, often it's waking them up, and they have trouble going back to sleep. So if you treat that, they just adjust back to it. It doesn't go away. They stop protesting about it. And again, that becomes an area to treat if they're like just so upset that they still have it. Okay, and then the area that I really did the most work on is pain. People will come in, I treat a lot of patients with pain, and if they had a rating of 5 or higher on the 0 to 10 scale, I would treat them. It didn't matter where the pain was or the pathology. And I did a pilot study first, which was published in the Thought Field, of 12 people, and I think it was 10 of them went down to 1. I did statistics on pre-level, post-level, even duration of relief. I didn't know about this 7-second treatment at that point. I then did a replication of that with 32 patients, and very similar results. And then I noticed that it didn't seem to matter if a person thought it would help them or not. So in the third study I did, I got ratings of saying to them, how likely do you think you'll walk out of pain with 1 or less? And it was from 0 to 100%. And then I did the treatments, and 51 of the 62 walked out with 0. And I looked at the ratings of results compared to expectations and found no relationship, which is kind of encouraging, because one thinks placebo effect, that if you believe something will help you, you'll get a better result. It turns out in my study it doesn't matter what a person thought, and that speaks to the power of the treatment. With thought field therapy, all you have to do is listen to people, listen to their complaints. Whatever it is, it almost doesn't matter what the disorder or the disease is, and you just ask them about their feelings about it, or ask about the sensations of it, and get a SUDS rating, and then treat it and bring it down to 0, and allow a person to experience something they've never experienced before.